everyone. I'm Laura Dormer from the Evidence Space, and today I'm joined by Kirk Geale of Quantify Research. With DIA's 2025 Real-World Evidence Conference approaching, we'll be discussing Quantify Research's role at the meeting and some of the themes they'll be highlighting. So thank you for joining me today, Kirk.
Yeah, thank you, Laura. It's great to be here.
To begin, could you tell us a little bit about Quantify Research and your expertise in Nordic real-world evidence?
Yeah, sure. So Quantify works across commercial and regulatory spaces, and we help our clients develop the sophisticated evidence that's required for today's success. And although we work with data from all over Europe, we do have a particular expertise and competence in Nordic real-world evidence, and that's a practice that we're proud to have pioneered almost over 15 years now. And we feel privileged to be a leading provider in this space, since Nordic real-world data is truly some of the best in the world. There are a few reasons for this. One is because it contains population data rather than samples. It's got very long longitudinal follow-up of 20, sometimes even 50 years. And it's also holistic. And so the data is very sophisticated from a patient perspective. It includes claims, but it also includes social determinants of health, EHRs, PROs, genetics, sick leave, and much more than that. And they're all linked together at the patient level deterministically. So our team really knows these data inside out, and high quality, fit for purpose data is in many ways, I think, the basis for regulatory grade evidence. And for us, that makes the Nordics a really nice place to be. And it's not actually for us just about the Nordics. Last year, for example, 20% of the EMA's safety studies included Nordic data. It's been used by the FDA, by NICE, by Health Canada, and others. And I think it's really the quality of the Nordic data that's made it such a mainstay on the global stage.
Now let's turn to your presence at DIA's Real-World Evidence Conference. You're speaking during the session, Ensuring Quality and Integrity of Real-World Data, Regulatory Insights. What can attendees expect from that discussion?
Yeah, so just by way of introduction, right? Like regulatory use of RWD is growing. We find that very exciting. That's very positive. But it also, at the same time, introduces challenges. Whether that's data review, inspection, quality assurance. They're all just more complex than they used to be. So, together with my colleagues from FDA and Droice Labs, we're going to be exploring some of the difficulties that regulators and industry face in ensuring data integrity, traceability, compliance, and things like that. And so while I think there are a lot of really interesting and important discussions that are happening in the world of methods, other discussions happening in the world of data, I also think it's critically important for us to put a bridge between those, and specifically that high quality data are one of the really important things that enable these high quality methods. And so those are both critical for regulatory grade evidence. And so if you're using these modern causal inference tools, one of the things that you need to do, for example, is to ensure exchangeability, control for confounding, that kind of thing. And of course, always easier said than done. But it's not enough just to invoke, the assumptions. You actually need to have the data behind it, right, to make the methods work, to convince the regulator. And so they're really inextricably linked. And so in the session that we'll be holding, I'm going to be presenting a post-authorization safety study that Quantify conducted for the EMA using Nordic data. And what I hope to illustrate in that session is how the quality of the data was central in driving several different aspects of the regulatory study that ultimately made it reliable and relevant for the EMA. And if you look at the regulatory review documents, we see the EMA highlighting a variety of data quality concerns. I'll share more about that at the conference. But the point is that if you want to create regulatory grade evidence, I think you really need to start with the data and put a lot of focus on getting that right.
That should be a great session, and I'm looking forward to learning more in San Diego. Before we wrap up, I'd like to ask one final question. Looking beyond the conference, how is Quantify continuing to deliver regulatory grade evidence and support better patient access?
Yeah, thank you for asking that. Our RWE practice is committed to creating evidence that ultimately moves the needle on patient access, and we're excited to be part of a variety of initiatives to develop Nordic evidence and its increasing acceptance globally. And part of that commitment for us is helping our partners find the right data. A lot of the time, that's Nordic, not always. But we want to be able to support evidence needs and ultimately the analyses and communication of findings. And while our core competence is in Nordic data, we're actually now able to apply our RWE expertise across Europe now that we've joined the Athegoras group earlier this year, which is working across Europe in regulatory, pharmacovigilance, RWE, and access. And I'm just really excited to be part of that group to provide that next level of service to our client.
Thank you. And thank you for joining me today, Kirk, and for sharing your perspective. We look forward to hearing more from Quantify at DIA's Real World Evidence Conference in October. Thank you.
Thank you, Laura.